Hello everybody and welcome to our module on ovarian cysts. Ovarian cysts are relatively common. They're often detected by ultrasound when an ultrasound is performed on a woman for abdominal pain or some other reason. They look like a black circular space by ultrasound as shown in this picture on the screen here. And ovarian cysts are often functional, and by functional I mean they usually come from a normal ovarian structure, so many times they derive from an ovarian follicle or the corpus luteum. By way of review, the follicles in the ovary go through a natural progression each menstrual cycle, so some follicles are recruited and mature, then ovulation occurs, and then the corpus luteum forms, which secretes progesterone, and then around the time of menstruation, the corpus luteum begins to degenerate. So functional cysts usually result from one of these normal structures in the ovary. A follicular cyst is a follicle that fails to release its egg, and a corpus luteum cyst is a corpus luteum that fails to degenerate. Before we get into specific types of ovarian cyst, let's briefly review how follicles work in the ovary, because this will be important to understanding how these cysts function. So an ovarian follicle contains an egg surrounded by cells, and the two key cell types found in a follicle are the theca and granulosa cells. The job of the theca cells is to convert cholesterol into androstenedione, which is an androgen, and these cells are stimulated by luteinizing hormone, or LH. The granulosa cells then convert the androgens from the theca cells into estradiol, which is an estrogen, and the granulosa cells are stimulated by FSH. So in a normal ovary, these two cells functioning together lead to the synthesis and release of estrogens in the female. So now that we've briefly reviewed the normal functions of the ovary and the cells in the ovary, let's start talking about cysts. And first we'll talk about follicular cysts. These are a very common cause of an ovarian mass in young women. They derive from an ovarian follicle that develops in the first half of the menstrual cycle. Remember, in the first half of the menstrual cycle, estrogen drives maturation of follicles and they grow in size. The reason follicular cyst forms is that this happens when an ovarian follicle fails to rupture and release its egg, or sometimes it happens when the ovarian follicle ruptures and then reseals. But either way, it doesn't release its egg and turn into the corpus luteum, and it stays a follicle inside the ovary, and that leads to formation of a follicular cyst. These follicular cysts are lined by granulosa cells, just like normal ovarian follicles, and for that reason, the granulosa cells make estrogen, and the fluid in the middle of the cyst is filled with estrogen. And in fact, these follicles may continue to release estrogen into the plasma, and this can stimulate the endometrium of the uterus to grow, just like estrogen normally does as part of the menstrual cycle. For this reason, a classic presentation of a follicular cyst is a relatively young woman who has pelvic pain plus irregular bleeding. Pain is caused by the growing follicular cyst, and the irregular bleeding is caused by the estrogen coming from the granulosa cells that line the cyst. One of the most important things for you to know about follicular cysts of the ovaries for step 1 of your boards is that this is the type of cyst that women with PCOS or the polycystic ovarian syndrome usually develop. In the endocrinology section in the video on the menstrual cycle, I talk about PCOS in detail. But this disorder gets its name polycystic because women with this condition develop multiple follicular cysts. They also have amenorrhea and excess androgens, which can cause hirsutism and insulin resistance and diabetes, and I talk about all of this in the menstrual cycle video, but the type of cysts they develop in the ovaries are usually follicular cysts. Our next type of functional ovarian cyst is called a corpus luteal cyst. So the corpus luteum is a large structure that forms in the ovary in the second half of the menstrual cycle. Its job is to produce progesterone. Basically, it's a temporary endocrine gland that forms each menstrual cycle to produce progesterone. This is a picture of one on the screen here. It's this yellow thing at the top. The reason it has lots of yellow is because that's cholesterol being used to synthesize progesterone. So if the corpus luteum fails to involute, that can lead to formation of a cyst. Now, one thing I want to point out here is that in pregnancy, it's normal for a corpus luteum cyst to form. In other words, the corpus luteum should not degenerate in pregnancy because it is maintained by the placenta. However, outside of pregnancy, if the corpus luteum fails to degenerate, then that can lead to formation of a corpus luteal cyst. The key thing to know about a corpus luteal cyst for step 1 of your boards is that these cysts may continue to produce progesterone, and that may delay menstruation. Remember that when progesterone levels fall because the corpus luteum involutes, that's what triggers the shedding of the endometrium and menstruation. If progesterone levels stay high because of a corpus luteal cyst, then menstruation won't occur. So the classic presentation of this type of cyst is pelvic pain, a missed menstrual period, and an adnexal mass, and this is all due to progesterone coming from the cyst. Let me briefly mention the evaluation of cysts by ultrasound. Now, you don't need to be an expert in evaluation of ovarian cysts by ultrasound, but I'll point out a couple of general principles which could come up on your exam. Follicular cysts are the most common type of ovarian cyst, and they tend to have a very thin wall, and they have no vascularity, meaning if you use the Doppler technique of ultrasound to look for evidence of blood flow, you won't see significant blood flow in the wall of the follicular cyst. This is a picture of what one looks like on the screen here. It has a thin wall and it's filled with dark material. In contrast, corpus luteal cysts tend to have thicker walls, and if you use Doppler to look for evidence of blood flow, you will see blood flow in the periphery of the cyst. This finding is called the ring of fire because Doppler makes blood flow have color, and it looks like a ring of fire as shown in this picture here. So thicker walls with evidence of peripheral vascularity and the ring of fire finding is what you see in corpus luteal cysts. It's not found in follicular cysts. The last type of ovarian cyst I'll mention is called a theca lutein cyst. These cysts are usually bilateral multiple cysts, and they get their name because the theca cells inside the cyst look like they are luteinized, meaning that they develop hyperplasia, which is what happens to theca cells when they're stimulated by luteinizing hormone. There's also edema and fluid inside the cyst. These are benign, but the key thing to know about theca lutein cysts is that they're associated with very high beta-HCG levels. So these occur in women who have twins who can have high HCG levels, or women who have a molar pregnancy also associated with high HCG levels. And they usually regress after the twins have been delivered or after the molar pregnancy resolves and the beta-HCG levels go back down to normal. And that concludes our video on ovarian cysts.